Welcome back. We're going to return now to our big focus on the COVID situation. The Delhi numbers are now quite frightening in terms of the overall numbers. Yes, the recovery rate is still positive as it is in many other parts of the country, but I think the absolute numbers remain a concern, and as a result of which there's been a complete relook at the containment strategy in Delhi in containment zones. It's an important report which has come out. The committee was headed by Dr. V.K. Paul of the Niti Aayog. He joins us along with Raghav Chadha of the Aam Aadmi Party in just a little while from now. But in the meanwhile, the Delhi government has arranged a special team with oxygen concentrators in every district. They'll reach out to homes of quarantine patients with these concentrators if the need arises.
Of the 25,000 corona positive cases in Delhi, 12,000 are asymptomatic or have a mild infection. They are currently under home quarantine, and now each one of them will be given a pulse oximeter to monitor their health. A pulse oximeter measures a person's pulse and the percentage of oxygen in their blood. It is a small machine that can be clipped onto a person's finger. Normal levels of oxygen in blood, according to doctors, is around 95 to 100%. Below 95% indicates there is a lung problem, and anything below 92% suggests serious illness and the need for supplementary oxygen along with hospitalization.
जितने अब होम क्वारंटाइन के केसेस होंगे होम आइसोलेशन के, दिल्ली सरकार हर होम आइसोलेशन वाले केस को एक ऑक्सी पल्स मीटर देगी. उस पल्स मीटर से आप हर घंटे में 2 घंटे में आप अपनी ऑक्सीजन नापते रहिए. अगर आपकी ऑक्सीजन कम होती है, हम आपको एक फोन नंबर दे देंगे, उस पर फोन कर दीजिएगा. हर डिस्ट्रिक्ट में हम ऑक्सीजन के कॉन्सेंट्रेटर रख रहे हैं. तुरंत हमारी टीम कॉन्सेंट्रेटर लेके पहुंच जाएगी जल्द से जल्द, और आपको तुरंत आपके घर में ऑक्सीजन दे दी जाएगी, और अगर जरूरत पड़ेगी तो आपको अस्पताल में शिफ्ट कर दिया जाएगा.
In the capital's containment zones, testing and contact tracing is being scaled up. In the southwest district, which has 36 containment zones, testing is also being done across 40 local medical clinics.
We have set up a separate contact tracing cell. We have come up with 5 more helplines, and these 5 numbers that we have taken are going to be used to call each and every positive case. We will also record their contacts, their primary contacts, and then this list will be shared with the medical officer concerned.
The good news is that from last week to date, the total active cases in Delhi have only gone up by 1,000, from 24,000 to 25,000 cases. This is also because of Delhi's high recovery rate of 55%. But Delhi currently has the second highest positivity rate in the country at 22.9%, which means that 22 people out of every 100 tested are found to be corona positive.
Delhi has tripled its testing from 5,000 tests per day until last week to 18,000 tests per day now. And going by how high Delhi's positivity rate is, testing and tracing is the biggest key to control further spread of the disease in the national capital. With camera person Sushil Rathi in New Delhi, this is Sukirti Dwivedi for NDTV.
So what the Niti Aayog has now proposed is a complete revamp of the COVID strategy in Delhi, particularly in containment zones. Now, what exactly is the Delhi COVID strategy revamp? Well, among other points, it's this. There'll be a remapping of all containment zones. Contact tracing will be strengthened. Enforce COVID-appropriate behavior that's often not being done. District-level governance will be strengthened. A zero-surveillance effort will be conducted to get an idea of the spread of the virus. And 20,000 people will be surveyed in the zero-surveillance effort. Well, joining us now, Dr. V.K. Paul, member of the Niti Aayog and chairman of the Board of Governors of the Medical Council of India. Thanks so very much for being with us. Raghav Chadha of the Aam Aadmi Party, and Dr. Rajesh Malhotra, the Chief of the COVID Facility at the Trauma Center, the All India Institute of Medical Sciences, somebody with immense understanding of where the disease is right now in terms of treatment and care. But Dr. Paul, let me come to you first. What exactly do you plan to do differently, or do you suggest needs to be done differently in containment zones in Delhi?
Well, in the response to control of a pandemic of the nature of COVID-19 is ever evolving, depending on how the situation emerges, and the response then varies from a very limited approach to travelers who came from outside and their contact tracing, We are now in a phase where we have containment zones, we have a massive testing strategy, and in that context, where the position of Delhi today is, where we are contributing as the state, almost 25% of the new cases, and as many as 25% of the deaths on a daily basis. If we take care of Delhi, a lot of problem of the nation is taken care of. So in that regard, now, building on what has already been done, the point that you enunciated just now will take our containment strategy, contact trace strategy, and the care of the positive cases to a totally different level.
How so?
And this will be brought about by a very concerted effort of the Delhi government, supported by the union government to the best possible extent. And we want to take it to a level where the disease will be contained in near future.
Dr. Paul, and I'll ask you about how you're actually planning to step up containment. But before I do that, or contact tracing, the one question that lakhs of people in Delhi will want to know, how soon can you implement these new protocols, and how soon will you get a fix on the situation in Delhi towards rounding off the curve? When will that process start?
Well, the process has already started. The augmented and more energized response is already in implementation for the last week or so. Part of the strategy, as you have highlighted just now, is tripling of the testing that has already taken place. Strengthening of the health infrastructure has taken place. And the Honorable Chief Minister has mentioned new initiative for those who choose to be and are fit to be looked after at home. What we will now do is to look at all the containment zone, and there are about 260 plus such containment zones. Now, these zones are places where there has been a case, there have been more than one case, and these cases are about together in a certain locality. Now, these are usually dense areas, and there has to be a way to cordon off that area systematically through perimeter control, and to make sure that then we undergo a house-to-house search to pick up positive cases in that area, in that population, and then process with their contact tracing and process with the need for isolation and so on. So what we will now do is, based on the data and based on the emerging data available from the new testing strategy that is now in motion, the restructuring of these containment zones will be done. We may go for larger containment zone if there are adjoining areas. We will go for a geographically manageable containment zone so that perimeter control can be more effective. And we may expand the containment zones as required. I want to tell the public that the cases in Delhi are not just confined to containment zones. In fact, there are less than 20% cases on a daily basis coming from the containment zones. Other areas have cases, and they are often as small clusters. So we may have to form new containment zones, and we have to look at Delhi as a whole, and indeed the adjoining NCR as a whole, for our effective approach to contain. Remember, this strategy will be necessary at this time to fullest extent possible to make sure that we don't let the situation in Delhi go out of hand.
Okay, sir, I just want to, Dr. Paul, one moment. I want to go across to Raghav Chadda. Raghav, as we speak now, the new number suggests 62,655 cases in Delhi. When one talks about contact tracing, how are you physically going to do that on the ground? How many additional contact tracers will be brought into the field? Give us an idea of this effort. It must be huge.
Look, of course, contact tracing has been something that the government of Delhi has been working on right from day one. And with the increase in the number of tests that are being conducted on a daily basis, we need to also augment and ramp up our contact tracing paraphernalia. Previously, roughly 5,000 to 6,000 people were getting tested for COVID-19 in Delhi. Now, roughly 18,000 people are getting tested daily for COVID-19 in Delhi. That is 3 times the number. And therefore, I think the contact tracing efforts also need to be augmented in the same ratio. What we are now going to do is also leverage technology in a big way, whether it's GIS mapping, cell phone triangulation, looking at the call records of the person, using mobile applications, so on and so forth, apart from, of course, the CDMO, that is the Chief District Medical Officer and the Vigilance Officer of that area, interacting with the COVID-19 patient on a regular basis to identify high-risk contacts. All these things will now be done because you see the, identifying a COVID-19 patient is one thing, but it is also equally important that all high-risk contacts of that particular patient also are traced, tested and treated. And I think that is going to be the strategy going forward. Apart from that, of course, as Dr. Paul has articulated, containment zones are being redrawn. The intensity with which these containment zone as well as the strictness with which these will be enforced is going to be increased. At the same time, what we will also see in Delhi is a serological survey where in a span of 2 weeks, more than 20,000 people will be tested for antibodies. And lastly, a great initiative by the government of Delhi has been undertaken and was announced by the Honorable Chief Minister earlier in the day, where if you are diagnosed with COVID-19 with mild symptoms or you're pre-symptomatic or asymptomatic, you can recover from the comforts of your home. You can stay in home isolation and you will be provided an oximeter using which you can, monitor your respiratory rate. A telemedical doctor will be in contact with you 4 to 5 times a day, and he will take the reading of the oximeter. And in the event, God forbid, your oximeter reading goes haywire or the level comes below 95, oxygen concentrators, an inventory of which is being created at every district in Delhi, will be immediately rushed to the premises of the patient. And if situation worsens, an ambulance will be sent and that person will be taken to the hospital. Okay. So all this has been relooked at. And, as the number of cases increase, perhaps we're in community transmission, we're in stage 3, we need to keep on changing our strategy and, augmenting the level of efforts that one puts.
Okay. Dr. Malhotra, Delhi has a high positivity rate now. It's also got a high recovery rate. What does that tell you about the nature of the infection that you see all around you, that you see at AIIMS?
So it is absolutely true, actually, that we have a very high recovery rate. And I think the focus should be on reducing the death rate. And for that, as has been said, the early diagnosis, the intensive monitoring and early hospitalization in case of the patient getting symptoms is the key. Because we have seen that, only in the mild to moderate cases, the treatment is really effective. The moment they go from moderate to severe case, actually, then it becomes very, very drug intensive and task intensive, and it's very difficult to salvage the situation, particularly when the patient goes on ventilator. And like it has been said, I'll again reiterate, there can be only 5 types of people: those who are positive, those who are contacts, those who are suspects, those who have not been infected, or those who have recovered. And I think the whole key is testing, because it's only by testing you will be able to group them into one of those 5, so that you know that those who are not infected and are high risk, they have to be isolated, and those who have recovered can really move out to the community and even work in the hospitals or help the healthcare providers, because they are now more or less immune. So I think testing remains a big key. Apart from the surveillance, the community surveillance, the house-to-house survey in the containment zones, I think this is what it is. When you have a very big task ahead of you, you have to put your money where it is likely to get the maximum returns. And I think this is the real forceful, focused campaign which was asked for, which is now, I think, the need of the hour.
Dr. Paul, in just the last couple of days, there are new lines of treatment which have been made easier, more accessible by the ICMR and others. For example, there is a homegrown variant of remdesivir which is available, other drugs which are also coming into the market. How much hope do you associate with these drugs?
Well, I think much before the vaccine, a real hope lies with maybe these medications, but some others that are in the pipeline. Definitely, with in the recent few days, a couple of weeks, we have seen a forward movement in that regard. The regulatory system has allowed emergency use of remdesivir based on the available data. The data is not final, but it is good enough for our country's regulator to allow emergency use. Likewise, favipiravir has been now opened up as a treatment, and this is a drug that can be used somewhat early. Remdesivir is used when you are a little more advanced, and then there is another drug which is used when the disease is even more advanced,
right?
Which is tocilizumab. Now, these three drugs, on the basis of the available data information, if it is being allowed for the use among patients, gives us hope, gives us a possibility of offering something for a disease which is so new. And I'm very hopeful that in the next few weeks, there will be other treatment options emerging on the scene. I'm very optimistic. I think vaccine is far away, but a plethora of drugs may be on our plate available for use of disease among common people.
I think that's something that's very welcome in terms of what our viewers would be looking at, that there are drugs around the corner which would be easily available. Hopefully that will make a difference in the lives, not of all, but certainly a decent number of patients. Thank you all very much for joining us.